Hello everyone and welcome back to my YouTube channel. So in today's video we'll be talking about black fungus, which is a COVID related mucormycosis. As India crosses the mark of 11,700 cases of black fungus and even Delhi claiming it as an epidemic to the whole nation, it is necessary for us to know what exactly is black fungus, what are its symptoms and how it is caused, and what's the reason behind it for it to spread prevalently during this time of COVID-19 infections. As said, black fungus is a mucormycosis fungal infection, and the spores to this infection are usually found in soil, earth, as well as air, and to some extent in our food too. So, talking of days before COVID-19, this black fungus is not that infectious. It means it's very less virulent, and a healthy individual to get this infected is very rare. But before COVID-19, this was seen in patients whose diabetes was uncontrollable and their sugar levels were very high, and even in persons who had their organs transplanted and were continuously on immunosuppressant drugs. And even in patients who were suffering from cancer, and usually they undergo the cancer therapy. And even in few countries there are reports of around 400 to 500 cases, but in India the number is increasing as COVID-19 is also increasing. This mucormycosis often affects the face, which is called as rhino-orbital cerebral mucormycosis, or it causes infection to the lungs, which is called as pulmonary mucormycosis. In the first one, that is rhino-orbital cerebral mucormycosis, what happens is the individual loses his sensation to the face, and there is discoloration on the face, severe headache followed by fever, and even a green discharge from the nose, and we can often find blood in the nasal discharges. And in similar ways, when the person is infected with pulmonary mucormycosis, what happens is it's again the severe headache, fever, and there is a sharp chest pain. But the most important issue is, why is this black fungus increasing rapidly during COVID-19 times? And what are the preventive measures we can use to handle this black fungus? One thing is that due to COVID, it is always a risk factor for secondary infections or fungal infections. That being said, in COVID infected patients, if we look at their blood level counts or blood counts, what happens is there is a decrease in a cell line called as lymphocytes, to be specific the CD4 and the CD8 cells, which causes them lymphopenia, and due to this lymphopenia there is a high chances of secondary infections, that is opportunistic infections or fungal infections, to get infected into our body. This is not only seen during the second wave, but even in the first wave, and even in the 2003 SARS infections, the data has shown that there was an increase in fungal infections during SARS in the 2003. And the reason why we are reporting the spike in the numbers of this black fungus cases is there are a lot of diabetic patients in India, and not only that, these diabetic patients are getting prone to COVID-19 infections. So to prevent this, first we must stop the misuse of steroids, and patients with less or mild symptoms or initial COVID-19 infection, or even during patients who do not need oxygen, are not to be treated with steroids. As even in the recovery trials, the data has shown that if the use of steroids is used in initial stages, the mortality and morbidity rate due to secondary infections is more, and mortality not due to COVID-19. Third thing is to always wear a mask, as we know that the spores are present even in air, and whenever you visit a construction site, never forget to wear a mask, because it's an area where black fungus is said to be more prone. Like to say, there are a lot of fungus that are being heard: the black fungus, the yellow fungus, the white fungus, aspergillosis names, and there is nothing to panic about this, because there is treatment available in the nation, and as we say that prevention is always better than cure. I hope everyone to be safe and follow the protocols given by the government, and stay true to the norms. Well, if you liked my content, so do kindly support and subscribe and like the video.